everyone, welcome back to my YouTube channel Physio's Healing Touch. So in this video, I will tell you how to calculate MMT of hip flexion and hip extension muscle. In case you want to know MMT of trunk muscles or shoulder muscles, I have already uploaded video for the same. I will link those videos so that you can check them later. So without any further delay, let's start this video. First, I will tell you MMT of hip flexion.
So the major muscles that are responsible for hip flexion are psoas major and iliacus, while the other muscles are rectus femoris, sartorius, TFL, pectineus and some adductor muscles. And the normal range of motion of hip flexion is 0 to 120 degrees. So first we will check grade 3, and if grade 3 is fine, then we will progress to grade 4 and 5. But if patient does not have grade 3, then we will progress to grade 2 and 1. So for grade 3, patient will be in sitting position and his hand will be supported to provide trunk stability. And then ask the patient to lift his leg off the table. If patient completes the range, then the grade 3 is fine. In this grade, you don't have to provide resistance. Remember, there should be no posterior pelvic tilt or anterior pelvic tilt because it can influence the strength of iliopsoas muscle. You can see after anterior pelvic tilt, the range of motion of hip flexors has drastically reduced. So that's why I am using my hands to stabilize the pelvis so that patient can acquire normal range of motion of hip flexors. If grade 3 is fine, progress to grade 4. So in this, the patient will flex his hip to the end range and then the therapist will apply moderate resistance. If patient can maintain this position for few seconds, then his grade 4 is good. Progress to grade 5. Now in grade 5, the position will be same, but the therapist will apply maximum pressure, maximum resistance. Therapist is applying resistance over the distal thigh. Now one important thing to remember is hip flexors are quite small muscles. So while applying resistance, you don't have to extend your elbow and apply your full pressure. Otherwise it will give a false negative break test. So in this video you can see the therapist elbow is flexed and he is applying resistance over the distal thigh. Now if patient's grade 3 is poor, progress to grade 2. In grade 2, patient will be in sideline and his lower extremity will be flexed for stability and his upper extremity will be supported by therapist. Therapist will be behind the patient and he will support his extremity, and with the other hand he will support the pelvis for stability, trunk stability. And then ask the patient to bring his knee up to the nose. If patient can perform this completely, then his grade 2 is good. Now for grade 1 and 2, the therapist has to support the testing limb under the calf with his one hand, and with his other hand he has to palpate those muscles, those iliopsoas muscles which is present just distal to the inguinal ligament. In grade 1, there will be no visible movement, but you will feel the contraction of those muscles. But in grade 0, there will be no palpable contraction as well. One common substitution seen in patient is they can use their sartorius muscle that can lead to external rotation and abduction of hip like this. So you need to avoid this trick movement and tell the patient to perform normal hip flexion movement like this.
Now I will tell you hip extension MMT.
So the major muscles that are responsible for hip extension are gluteus maximus, semitendinous, semimembranous and long head of biceps femoris, and other muscles are adductor magnus, inferior fibers and gluteus medius posterior fibers. Normal ROM is 0 to 20 degrees. So for grade 3, the patient will be in prone line as you can see, and the therapist will be standing just beside the tested limb, and with his one hand he will stabilize the pelvis and then ask the patient to perform hip extension. Now if grade 3 is fine, progress to grade 4. So in grade 4, the patient will complete the available range and after that apply moderate pressure just above the ankle joint. If patient maintain this position, progress to grade 5. For grade 5, the positions will be same. The therapist will stabilize the pelvis and then the patient will complete the available range of motion and then the therapist will apply maximum pressure. In case you want to isolate gluteus maximus from hamstring, then you need to flex the knee, and then for grade 3 you have to extend the hip joint. And for grade 4 and 5, the therapist will apply moderate to maximum pressure over the distal thigh. So this is the way if you want to check only gluteus maximus muscle strength. Now let's jump into grade 2. So for grade 2, the patient will be in sideline and the therapist will be behind the patient, and with his one hand he will support the pelvis and with his other hand he has to support the limb and then ask the patient to perform hip extension. Now for grade 1 and 0, for grade 1 you have to palpate the muscles. There will be no visible movement, but if you will palpate the muscle then there will be palpable contraction, and for grade 0 there will be no palpable contraction as well. Now for isolated gluteus maximus MMT, all the positions will be same, just you need to flex the knee joint and then perform hip extension. So yeah, I hope it was helpful and it cleared your many doubts. I tried to cover each and every point and tried my best to make you understand. So if you really found it informative, then please like, share and subscribe to my YouTube channel Physios Healing Touch. Your one like and comment means a lot to me.